41-year-old patient presents to the clinic some 10 days after finishing trip with friends. Apparently, he spent up to 8 hours a day by the side of river during the week he was away. Over the course of the last 5 days, he has developed a severe fever with pyrexia of 38.8, joint pains, myalgia, and a dry cough. He awoke on the morning of presentation to the emergency department with jaundice sclera. His blood pressure is 100 by 60, pulse is 95 per minute and regular. There is a purpuric rash and he has jaundice sclera. He has scattered coarse crackles on auscultation of the chest and right upper quadrant pain on palpation of the abdomen. Investigation hemoglobin is 9, WBC count is 12.9, platelets low 67,000, prothrombin test is rate 33.1, and sodium is 138, potassium is 5.4, creat is 1.45, and ALT is 430, that is raised. Sir, I cannot see more
Yeah,
of the question.
yeah. I'm going to scroll down.
Which of the following is the most likely diagnosis? Option A is hepatitis A, option B is leptospirosis, option C is typhoid fever, option 4 is meningococcal septicemia, option 5th is hemolytic uremic syndrome. Okay. Sir, I would like to go with the questions again, sir. Like I would like to go to
Yes,
the
yes,
details
yes,
again.
yes. Okay, let me scroll up for you.
So basically, went with his friends and developed fever with jaundice, with AKI, with hemoglobin has also been reduced. Definitely, there could be as and the bilirubin is also raised. So the chances are might be because of the hemolysis he might have had this thing. So the option A hepatitis obviously doesn't explain the AKI, so it's ruled out.
Okay,
So and again meningococcal septicemia would definitely have some signs of meningitis like confusion or something like that, drowsiness, nothing like that. So option D is ruled out.
okay,
Option C typhoid fever again less likely. Could be one. I would like to keep it. Leptospirosis could be the thing,
okay,
but would not result the hemolysis and all. So
okay,
ultimately, the option E, hemolytic uremic syndrome, feels more likely the answer. But so much deranged LFT is again pushing me towards leptospirosis.
okay,
I'd I'd like to go with option E, sir, hemolytic uremic syndrome.
okay, okay. So what do you get in hemolytic uremic syndrome? What is
Sir,
hemolytic?
basically, it happens after E. coli infection, sir, most likely.
Okay, okay. So that patient should have preceding diarrhea, isn't it? Especially bloody diarrhea, followed
Oh,
by.
yes,
So there are
yes, sir.
two types of hemolytic: typical and atypical. Okay, the typical
Okay.
is what you are discussing. That is, patient would have bloody diarrhea followed by few days later present as severe hemolysis, low platelet, and renal failure. Okay,
Yes, sir. Yes, sir.
yes,
Yes.
that's what you are suspecting. Okay, so in that scenario, you would definitely have high bilirubin. Okay,
Yes, sir.
which is the case, and you would have high creatinine. That is also the case. You have low platelet, you anemia. Okay, so that would
Yes, sir.
perfectly fit the parameters. Okay, except that
Yes.
the what they would alkaline phosphatase, it is almost 3 times higher, isn't it, alkaline phosphatase? That means there should be some kind of obstruction, isn't it? Okay,
Yes, sir.
if you look at the liver enzyme, so whether it's obstructive or hepatic injury, we see by looking at ALT and ALP, comparing ALT and ALP. Okay, if
Yes,
you
sir.
see here, the ALT is more than alkaline phosphate. That means there is significant liver injury. Meantime, there is some obstruction as well, isn't it? Otherwise, why the
Yes, sir.
alkaline phosphate should increase? Okay,
Yes, sir. Got it, sir.
so something like obstructive pattern is also there. Okay, but the history is not fitting into hemolytic uremic syndrome. Okay, if you look at the
Yeah.
history, patient has recently went for fishing trip. Okay, so each word is very important. Somebody has gone for fishing. Okay, that means he's gone to some river or has gone to the area where maybe lakes or somewhere there. Okay,
Yes, yes.
so he spent some time there. Okay, Next, after 5 days, either fever, myalgia, dry cough. Okay, there's some multisystemic involvement. Okay, BP is on lower side. Okay, there's a rash. You get itching, jaundice, and there are coarse crackles on auscultation on chest and right upper quadrant pain. Okay, that means there's significant liver involvement. Plus, there is probably pulmonary involvement as well, lung involvement as well, isn't it?
Yes,
Okay,
sir. Yes.
so you won't get patient has multi-organ dysfunction here. Okay, liver
Yes.
involvement, kidney involvement, lung involvement following the fishing trip. Okay, so what would be a better option?
The leptospirosis in that.
Leptospirosis. Okay, you have seen any patient with leptospira?
Yes, sir.
Okay, okay. So this is very common in the even in India after
India
the
is.
rainy season, isn't it?
Yes, sir. Yes,
Probably
sir.
very common in even in not only in rural, even in cities. Okay, so leptospirosis should come. Okay, so you
Had
think
there
about.
been no hemolysis, sir, I would have definitely gone with leptospirosis. Like the hemoglobin was low, so it confused me.
Okay, okay, fine. Okay, so hemolysis can come in leptospirosis. Okay,
Okay.
so other important, even sepsis can have low hemoglobin. So we don't have any clear evidence that there is hemolysis. Okay, if it was hemolysis, then we should have got some LDH
LDH.
to be
LDH.
higher, or they should have given bilirubin total and direct bilirubin. So that also we are not
Okay.
given. So just
Okay.
we that there is anemia. So we don't know, it could be due to sepsis. Okay, multi-organ failure, we never know this. Okay, but among the, so the fishing trip, any contact with the water bodies, okay, always think about leptospirosis in your exam. Okay,